Hi, I'm Stuart Isaacson. I'm Director of the Parkinson's Disease and Movement Disorder Center of Boca Raton in Boca Raton, Florida. I've been involved in movement disorder neurology for over 25 years, trying to develop new therapies to help our patients living with these disorders. Essential tremor is the most common movement disorder, and we lack most often effective treatments for our patients, and certainly treatments that are well tolerated. Medications, oral medications, have systemic side effects, and they really limit the utility of using these types of medications, especially as people age. And as people age, they have more and more tremor from essential tremor. It more and more impacts their daily activities, prevents them from doing daily tasks, and they become less able to tolerate the medications. And to compound the problem, most of the medications don't work regularly either. So we've long had a yearning for new therapies that could effectively manage and reduce tremor, allow patients to carry on their daily tasks, and have demonstrated tolerability. Well, the Felix is an interesting device because it's localized and worn. It doesn't have systemic side effects. It's able to not only reduce tremor by giving this stimulation to these peripheral nerves that changes brain activity and reduces some of the oscillations and reduces tremor, but it uses artificial intelligence to really personalize the therapy for each individual person. Well, essential tremor is a difficult disorder. It begins very gradually, and decade by decade, the tremor increases in amplitude and in affecting different tasks. And while it might intrude onto different tasks like writing or holding a soup spoon or holding a cup of coffee, as decades go by, it becomes more and more difficult to even do that. Suddenly, patients have something that they can use and control that can reduce tremor and restore them back to activities that they had difficulty doing for decades, and now they can do them again. It really can be a real game-changing therapy for these patients who are used to things getting worse and worse, and now suddenly they have something that can make things better, and to do it without systemic side effects. Many patients have had to choose between having tremor that increases over time or thinking about surgical treatments like deep brain stimulation, focused ultrasound, and some patients undergo these advanced surgical procedures and have reduction in tremor, but many patients fear these surgical options and are sort of in limbo. Fascicle really opens up a new door and is part of a new wave of products that can help patients have less tremor without having to resort to surgery. Well, Fascicle is actually combining technology that's been proven to reduce tremor with artificial intelligence, allowing a personalization and a precision approach to each of our patients. Is how we're trying to think about advancing therapies and improving our patients. And Fascicle has been able to demonstrate in these studies a reduction in tremor and not having to pay the price of systemic side effects or having to have brain surgery.